Minimally invasive procedures in the treatment of sleep-related breathing disorders are becoming more and more accepted. Here you see the use of bipolar radiofrequency-induced thermotherapy to treat habitual snoring. It's necessary to arrive at a proper diagnosis of the sleep-related breathing disorder in order to rule out other conditions such as obstructive sleep apnea. The treatment shown here is carried out according to a protocol by the Mannheim University ENT clinic. A frequent cause for habitual snoring are vibrations in the soft palate, the uvula and the tissue in the area of the palatine arches. The treatment of the soft palate and the uvula with bipolar RFITT can be performed on an outpatient basis using local anesthesia. The application of a topical anesthetic to the palate and the back of the throat, a 10% lidocaine spray for example, may be necessary to counteract the gag reflex. For local anesthesia, the injection of 0.5 to 1 milliliter of a 2% lidocaine solution is recommended at 5 points below the border between the hard and soft palate. These injections have the additional effect of enlarging the palatal volume during the operation and reducing the risk of mucous membrane damage. The Celon ProSleep Plus applicator is used to treat the soft palate. The size of the resulting coagulation depends on the power setting of the power control unit. For the treatment of the soft palate, we recommend a power setting of 12 watts. The higher the power setting, the smaller the coagulation. The tip of the applicator is inserted towards the center of the palatal muscle until the applicator's insulation tube is touching the tissue. 5 punctures are recommended at regular distance intervals at around the midline of the soft palate. The needle tip should not be inserted up into the uvula. Make sure that the tip is located as precisely as possible in the middle of the tissue to avoid superficial lesions of the palate at the front or back. Once the applicator has been positioned, the power supply is activated by pressing the foot switch. The status of the coagulation can be monitored via the acoustic signal. An increasing pitch of the signal indicates the progress of coagulation and the increasing tissue impedance. The power output is controlled automatically. A high-pitched intermittent signal indicates the completion of the coagulation process. The power output is reduced automatically so that overdose effects are excluded. Volume reduction, accompanied by a tightening of the palatine tissue, is apparent within the next 4 to 6 weeks as a result of the body's resorption process and the formation of scar tissue. Pronounced webbing and significant hypertrophy of the uvula may indicate a necessary reduction of the uvula and the soft palate mucous membrane. This radiofrequency-assisted uvular palatoplasty can be carried out during the same treatment session using the Celon ProCut system. We recommend a power setting of 20 watts. The positioning of a neutral electrode on the patient is not required. Hold the uvula with the forceps, which also serves as a return electrode. Press the foot switch to activate the power supply. Make sure to proceed in the right order. First, take hold of the uvula with the forceps. Second, activate the foot switch. Only then apply the cutting electrode to the tissue. The resection of excessive mucous membrane, as performed, is triangle-shaped on both sides of the uvula while making sure not to damage the muscle. Resection of the tip of the uvula is the next step. The uvular musculature is also left in place as far as possible. The healing process over the following weeks will create a further shortening of the uvula. Reduction of the uvular and soft palate mucous membrane should be carried out to the extent shown in this illustration. Post-operative analgesic therapy with ibuprofen or diclofenac is recommended to alleviate post-operative pain. The pain may last for about 1 week. Clinical experience indicates that an additional treatment of the soft palate is usually necessary to achieve an optimal result. The follow-on intervention should only be conducted after a period of at least 6 weeks. We wish you much success using the Celon method. For more information, please contact Celon directly or visit our website at www.celon.com.